In the great sweep of history, some stories are whispered on the wind. They tell of a time when the world was young, a time of gods, a time of pharaohs. Thousands of years ago, the river Nile flowed. It flowed past stones shaped by human hands. People built huge temples. They raised pyramids that touched the sky. They lived and died by the rhythm of the water. But they did more than build for eternity. They cared for the living. In the shadow of these great monuments, another kind of work was done. A quieter, more urgent work. Egyptian healers learned to mend the human body. Thousands of years before modern hospitals, Egyptian healers were performing surgeries that defied the limits of ancient science. In the early days of Egypt, there was no line between the sacred and the scientific. Medicine and religion were like two streams flowing into the same river. They were one. A temple was more than a house for the gods. It was a place of healing, a sanctuary for the sick and the injured. Priests often served a dual role. They were doctors of the soul and of the body. A person suffering from an injury might first say a prayer to Sekhmet, the lion-headed goddess of healing, and then they would receive a bandage from the hands of her priest. This blend of spiritual and physical care was powerful. The healer might chant a spell to ward off evil spirits that caused disease. Then, with great care, they would clean and dress the wound. This approach helped people find comfort in two essential ways. The mind was soothed by ritual and faith. The body was treated with practical skill. It was a holistic approach to medicine, one that understood that a person's belief could be a potent force in their own recovery. It is called the Edwin Smith Papyrus, one of the oldest medical texts in the world, written around 1600 BCE, a copy of a much older work, not a book of spells, but a clinical manual. 48 cases of trauma, organized from head to toe. A wound on the head, a broken nose, a dislocated jaw, a fractured collarbone. Each case follows a careful structure: the title, the examination, the diagnosis, and a verdict, an ailment which I will treat, or not to be treated. In the cool darkness of a temple room, a healer bends over a patient. The air is thick with the scent of incense and herbs. Light from a single oil lamp flickers across the walls. It catches the glint of a bronze instrument. It illuminates the careful writing on a scroll. These were the first operating theaters. These were the first medical schools. Here, in the heart of an ancient civilization, the long story of surgery began. A story of compassion, a story of courage, a story of the endless human quest to heal. Egyptian physicians mastered stitching wounds, setting fractures, and even early forms of brain surgery. Obsidian, volcanic glass, fractured to an edge far sharper than a modern scalpel. Saws to cut bone, drills to create openings. A bone fragment pushed inward, pressing on the brain. The papyrus describes cases like this. Surgeons needed instruments to lift or pull broken pieces, and they had them. Needles and thread for closing wounds, splints for setting limbs. They understood alignment and immobilization until healing began. Their method was systematic. Observe, diagnose, decide how to act, or not. Physical evidence of their knowledge, quiet, sturdy proof of the surgeon's skill. Their skills seem both ancient and surprisingly modern to us now. What they had was observation, experience, respect for the body, and the courage to intervene, to cut, to stitch, to set a bone. There was no modern anesthesia, and yet they did not operate on people who were fully alert and suffering. They had a pharmacy from the natural world, ways to dull the senses. Most importantly, opium, from the poppy flower. Opium is a powerful narcotic. It dulled pain and induced a sleepy, dreamlike state. It made the surgeon's work possible. They used other substances too, large amounts of beer and wine, poultices and potions from many herbs. Some plants had real medicinal properties. Others worked through belief. A patient who trusted the remedy often felt better. Papyrus prescribes honey for wounds. Honey has natural antibacterial properties. It keeps harmful germs from growing. They used moldy bread as a poultice. Strange to us, but some molds produce things like penicillin, a primitive antibiotic therapy. Effective, even without knowing why. The healing ritual was part of the medicine. They would call upon gods of healing, Sekhmet, Imhotep. Spiritual care and physical treatment were one. The chants calmed the patient. The rituals created safety and hope. In the healing room, the body, the mind, the spirit, treated as one. The knowledge born along the Nile did not stay there. It traveled. On ships that sailed the Mediterranean, scholars and traders carried it between cultures. The influence of Egyptian medicine spread far and wide. Hippocrates studied the work of the Egyptians. Galen studied the work of the Egyptians. They read the old texts. They learned the old ways: diagnosis, treating wounds, setting bones, ideas that flowed and grew. This ancient legacy is still with us. Today, a surgeon stands in a brightly lit operating room. Advanced technology surrounds them. Sterile tools and powerful drugs are at hand, yet the core principles match those in the Edwin Smith Papyrus. First, observing, then making a diagnosis, then deciding on a course of treatment. From ancient scroll to modern textbook is a long, continuous path, each generation built on the last. A surgeon's skilled hands show thousands of years of learning. The past is present in that room. The quiet wisdom of the Egyptian healer informs modern confidence. In the shadow of the pyramids, courageous people tried to save lives. They tried to ease pain. Their work echoes in our hospitals. Papyrus notes still teach the art of healing. Ancient surgery is a story of ingenuity, clear thinking, and brave action. Above all, a timeless desire to care for one another. Primitive tools, strange rituals, but the goal is the same: help the sick, mend the broken, save a life. Their legacy lives beyond museums. In every stitch, every bandage, every reassuring word a healer speaks to a patient. Their journey was a first step on a long road, a road we still walk today. Their legacy proves that even in the shadow of the pyramids, humanity was already searching for the cure.